Welcome to the Biological Measures and Specimen Handling webinar. My name is Anthony, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Throughout the conference, we will conduct question and answer sessions. Please note that this conference is being recorded. I would now like to turn the call over to Tracy Williams. Ms. Williams, you may begin.
Welcome, everyone, to the CTN webinar series. Today we will be discussing biological measures and specimen handling, and the presenter will be different than what is posted in our catalog. Dr. Roshana Rothwell will present, and I would like to invite Roshana to begin.
Thank you, Tracy. Good afternoon, everyone. So first, of course, I want to go over the presentation outline. We will be discussing common biological measures and testing in the CTN, and they're listed below. After that, I will talk about collecting, labeling, storing, and shipping recommendations for biological specimens. We will end this presentation with universal precautions that should be followed by research staff when dealing with biological specimens. So in the CTN, there are a plethora of different assays and tests that we use. For urine screening, there's for drug use and pregnancy. More novel in the CTN, lately we've been using drug hair analysis. We also do alcohol breath testing, ECGs, electrocardiogram, blood chemistry, hematology, and collect vital signs from participants. So what is the purpose of these assays? These assays can have varied purposes. For example, when doing inclusion-exclusion criteria in the protocol, we ask that certain baseline measures be taken. For example, we may ask for a blood sample to measure PKs and LFTs. In so doing, we want to ascertain if this potential participant has a good safety profile to even begin the study. So it's important for us to understand if this person is strong enough and is well enough to even be a desirable participant. In addition, I've seen for primary outcome and secondary outcome, urinary drug analysis as well as drug hair analysis. And those affect the research integrity of the study. Contingency management. As far as UDS, I've seen in certain studies where if a participant has a negative urine or shows reduced use, they get a reward or contingency management offered. These types of approaches have been used in both behavioral and pharmacological studies, or a combined study where we see behavioral and pharmacological interventions. So the first type of testing I'm going to go over is the urine testing. With urine testing, there's urinary drug testing and urine adulterant testing. So the standard UDS card that we use in the CTN captures 10 different key drugs. These drugs being benzodiazepine, amphetamine, marijuana, methamphetamine, opiates at a 200 nanogram threshold, cocaine, MDMA, ecstasy, oxycodone, methadone, and barbiturates. So if you can look towards the right, that's the typical UDS that we send out to you guys. It's the ClearWave Quick Tox Urinary Dipcard. And what we simply mean by ClearWave is that this Dipcard has been cleared and approved by the FDA. It can be used for professional use, such as what we do in CTPs, as well as for homes. So the standardized Dipcard on how these 10 key drugs were chosen were actually through input from lead teams, the NIDA CTN, and the team task force. Essentially, what this Dipcard allows for is standardization. One of the key goals with standardization is consistent data collection across all CTN studies. In so doing, there's a standard UDS ECRF that is used to capture the results of the UDS Dipcard. And while the Dipcard itself is standard and the UDS ECRF are standard, the drugs of interest that will be analyzed for a study are decided by the lead team or the lead protocol development team. So before you conduct a urinary drug screen, which is when you actually dip the 10-panel UDS card into the urine specimen, we ask that you do urine adulteration testing. Essentially what adulterant testing does is it checks the integrity as well as the validity of the urine sample that you are collecting. It allows for visual determination. It's very quick and easy. It's simply one dip in the urine, wait, and you should be able to see some results. So is it possible to cheat a UDS test? Of course. We know that it is possible, and these are some of the essential ways in which people do cheat UDS. One is by tampering, by adding any chemical solution, diluting it with water, water loading, and essentially what water loading means is somebody ingesting or consuming large amounts of water to flush out their system. The adulterant strip can both detect tampering and water loading. Another way people cheat UDS tests is by actually switching drugs that are not captured by the UDS. For example, bath salts now have become the trend, and they're not captured by the UDS. Synthetic cannabinoids such as K2 and spice are not captured by the UDS test. So, and also, people can take vitamins. It's been shown that vitamin B3 can aid and speed up your metabolism, thus making your body excrete your drugs quicker, and therefore limits that 1 to 3 day detection window of UDS, makes it even smaller. Another way in which people cheat UDS is actually by switching urine samples. And yes, there is a commercially available device that allows you to do this. It's called the Wizinator. If you're interested in checking it out, of course the images are not safe for work. I wouldn't advise you to do it at work. But essentially what it is that it provides you with it's more for males, and it provides a way of kind of fooling observed urine. And the pouch is actually attached to a belt, and it has the urine sample that's clean, and that person can make believe that they are actually given a proper urine sample. So with all those things considered, that's why we have the adulterant test. So the adulterant test checks for 7 things, those things being creatine, nitrate, pH, specific gravity, glutaraldehyde, bleach, and pyridinium chlorochromate. Nitrate, glutaraldehyde, bleach, and PCC, which is pyridinium chlorochromate, are not present in a normal human urine sample. So that automatically comes up as an abnormal high since it's not present. So when you have the adulterant test, it's a little strip. You dip it in the urine. After about 45 seconds or so, you should be able to read all 7 results. And how it's read is there's a normal, which is the middle fat column, abnormal low, which is the left column, and abnormal high, which is the right column. As you can see here, glutaraldehyde, nitrate, bleach, and PCC do not have a normal reading. They actually have a negative reading because they should not be present in normal urine. The color coordination of the adulterant strip is very different between abnormal and normal and abnormally high. So, for example, if you look at pH, an abnormal low pH is indicative of like an orange hue, whereas normal is green, and then abnormal high is a dark blue. So you should be able to distinguish on site what's abnormally high, low, or normal. So as far as after you dip the test, your pH reading is immediate. If you wait 30 seconds, you can determine if there's bleach and PCC present in the sample. If you wait 45 seconds, you can determine if creatine, nitrates, and specific gravity, and glutaraldehyde. We encourage, as far as the CCC, to practice until you are comfortable with timing and the process. We definitely encourage this for new staff that may join the study after the study starts, or staff that you have on before the study actually starts. And also, we would encourage you to use, when you get this adulterant code or in the package, laminate it and provide it wherever you see it, wherever you are doing your UDS, because that way it'll provide a constant guide or a record of what you should be looking for. So common adulterants. Dilution is the most common form of adulteration by adding anything to the urine. Two of the tests, specific gravity and creatine, determine if a urine has been diluted. And if it's low specific gravity or low creatine, it's pretty much one hands-on that this is a diluted sample. Common dilutants are bleach, vinegar, Visine. As you can see, they're very household handy items. Also, there are commercially available adulterants. I love the names such as Instant Additive and Urinary. These commercial adulterants have glutaraldehyde in them. And as I told you before, glutaraldehyde is not present in urine, normal urine. Also, nitrates. And these nitrates can be found in commercially available adulterants such as Busy and Clear. I love these names. And they actually work by oxidizing the cannabinoid receptor, thus affecting THC results. pH, for a normal pH from a urine, can range between 4.6 and 8, with a neutral at 7 being the norm. Of course, if you're adding chemicals such as bleach, nitrates, and things like that, you're going to affect the pH balance of urine, thus causing it to be abnormally low or abnormally high. And as far as PCC, it's sold under the brand name Urine Luck. And once again, it should not be found in normal urine. So the proper UDS procedure. First, you would have your participant utilize the temperature-sensitive UDS cup. And in my opinion, the UDS cup is the first step to understand if a sample is adulterated, because the average temperature has a range of 90 to 100. While people are adding bleach, water, and things like that, it should decrease the temperature. It should not be at normal body temperature. So if you don't get a temperature reading, that should kind of perk your ears there. Wait a minute, when I do this let me really do this adulterant test, because it's probably adulterated. So it's not that the adulterant test is an option, but it's one of those things where if you notice your temperature is not coming up in the first place, it should send a warning sign to you. Once you have done the temperature, it has passed, it's in that 90 to 100 range, dip the urine, the adulterant strip. Now, for protocols that may use a pregnancy test, what we ask people to do is to actually take a separate sample, fractionate it, and then perform the pregnancy test. Do not dip an adulterant strip in the same sample and then perform a pregnancy test. It may alter the results. So once you have done the adulterant test, you can proceed to the UDS Dipcard. So what we ask you to do is actually to dip the Dipcard in the urine up to the blue arrows for at least 10 seconds. Once you've done that, replace the plastic cover, lay the device on a flat surface, and wait 5 minutes. Please read UDS results after 5 minutes. We ask that you do not prolong reading them, like an hour, 2 hours. 5 minutes, read your results and record them. So common UDS issues would be, 1, the chain of events of the UDS test is not completed appropriately. For example, the adulterant strip is not utilized. You proceed straight to the UDS Dipcard. We ask that you first collect in the temperature cup, adulterant strip, Dipcard. Another common issue is the Dipcard is not dipped in the urine up to the blue arrows. This creates a wicking issue, so the urine cannot get up into the matrix or the immunoassay matrix of the Dipcard. The UDS results are read far too long after the test is performed. And also, supplies are not kept at recommended temperature, which is at room temperature, 15 to 30 degrees Celsius. Another problem is that the UDS pouch is opened prematurely. Like, it comes in a foil-wrapped pouch, and people will open it and leave it out and then perform a UDS. In order to make sure the test works properly, open it just prior to use. So I'm going to get onto the other types of testing, such as drug hair analysis and ECGs, but I wanted to open up the line and ask if there were any questions regarding the urinary testing that I just presented.
Thank you. We will now begin the question and answer session. If you have a question, please press star, then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, for any questions, please press star, then 1 on your touch-tone phone.
Do I have any questions?
At this time, I show no questions.
All right, I'm going to proceed. Of course, if a question comes up, I will open up the lines again. So hold on to it, write it down, and capture it, and I will definitely get to it. So now we're going to close the lines, and then I will go on with the remainder of the presentation. So the other types of testing are drug hair analysis and ECGs. So drug hair analysis, essentially, when you have someone that does drugs, the drugs are metabolized into the bloodstream, go into the bloodstream. As the blood nourishes the follicle, the chemical substance get entrapped in the cortex of the hair shaft. It takes about 5 days for the hair to grow above the scalp. And also with hair testing methods, what they do is they essentially wash the hair, melt the hair, and by melting the hair, they actually can get out those trace amounts of substances that are embedded within the shaft. And so by saying that, hair testing results cannot be significantly altered with shampoos. If somebody's, they'll say like bleach or something like that, it cannot be significantly altered because it's embedded within that hair shaft. So if you want to do a comparison between drug hair analysis versus UDS, the difference, drug hair analysis allows for a longer detection window, 3-month detection to be exact, and this 3-month window is represented with 1.3 centimeters of hair growth. So when you look at the scalp, it's that first 1.3 centimeters, from the scalp, which when you cut that, that's what the drug testing labs use to determine 3 months use. UDS only allows, depending on the drug class, 1 to 3 day detection window. Drug hair analysis can determine history of drug abuse. For example, that 1.3 drug closest to the scalp represents 3 months. If you go down another 1.3 centimeters, you can get 6 months, and so on and so forth. UDS determines use, but not necessarily abuse because it doesn't cover a large time frame. It's hard to tamper with the test because A, it's done in the lab, it's not done at a CTP. So, and your hair is your hair. So what happens is once it's cut, it's sent off, there's no tampering done at that point, it's just pretty much done at the lab. Another big difference between drug hair analysis and UDS is the economical cost. Because the CCC, we order a bulk of UDS, we get the UDS test at a pretty decent cost because we order them in bulk, whereas with the hair test, it can be 10 times more. Another advantage of drug hair analysis is that you're not just limited to head hair. You can also use body hair, and I'll talk about that in a little bit. And what they have found in research is that hair color may affect UDS results. For example, brunettes versus blondes. I think it's so funny. Brunettes actually, because of the melanocytes in the hair, for some reason the drugs stick better to that hue versus blondes, who have a lighter hue of hair, and drugs have a hard time sticking to it. That's in the literature. Also, they've also shown that treatments such as permanents, relaxers, dyeing may impact the hair color, may impact the hair results. And of course, this is a disadvantage for people with limited hair, somebody that's bald. So for collecting the hair sample, head hair is the preferred collection method because, once again, it represents that 3-month window. What we asked our site to do is to grasp a small lock of hair. When you lay it across your finger, it should cover, the sample should fall within that first kind of indent to the second indent on your finger, as pictured there. You want to cut as close to the scalp as possible without cutting the scalp. So we really want you to cut as close because, once again, that ties into that 1.3 centimeters that's closest to the scalp, which gives you that 3-month detection window. And also, because people are vain and you are cutting hair, we ask that you select an area that is not detectable after sample collection. As you can see in the photo above, it's at the crown of the head. She has like a part and a clip. With the clip being there, after this hair sample is collected, when she takes that clip off, you will not be able to tell that she gave a hair sample. So there are some challenges with drug hair analysis. One of them being the participants. I mean, you are cutting hair. People are vain. People are particular about their hair. So I always tell sites that it's important to kind of assuage any kind of doubt, apprehension about giving a hair sample. You can always say, hey, I'm taking it from the crown. Let them, show them where you want, what sample you want, remove the clip, show them how it won't be detectable, any way to make the participant feel comfortable. Also, there has been, people are bald, hairstyles don't allow for collection of head hair, which is where the second alternative comes in, is body hair. Body hair is thinner and is less than 1/2 inch long. You can collect from different spots. For example, you can collect from both arms, legs, chest. It's just that the head hair and the body hair cannot be combined because they represent different detection windows. The head hair, the first 1.3 centimeters from the scalp, as you know, is 3 months. However, body hair, the turnover is longer, so the body hair has a detection window of a year. So when collecting, a sample, you're looking at a longer detection time frame with body hair. But the advantage is that you can combine it from different spots to make a nice, efficient sample. So for body hair collection, since I showed head hair, I felt like I should show body hair. We asked our sites to take a white piece of paper and make a trough. Pictured here is an arm. You would put that trough underneath that arm. Shave with dry shave. No shaving cream, nothing like that is needed. Dry shave that portion of the hair. Let the hair fall in that paper trough. Then you would transfer that to the collection mechanism, which is that foil, and then you put the foil inside the white card. So how much hair is needed for drug hair analysis? Well, each screening, for the screening of all the drug classes, 8 milligrams of hair is required. For drug hair analysis, there are 5 different drug classes that can be tested: opiates, THC, amphetamines, PCP, and cocaine. Each test requires 20 milligrams of hair for a combined total of 68 milligrams of hair if you're going to test for all 5 classes of drug. So as far as a sufficient amount of hair required, the vendor that we use for drug hair analysis is Psychomedics. One of the reasons why we chose them is because they require less hair. So a lot of other vendors require a big significant amount, whereas the vendor we chose requires only, if you were to look at a pencil, a sharpened pencil, and look at the tip of the lead, that big round piece, that's about how much hair they require to complete their test. So what happens if you send a sample to the lab that's too small? Pretty much the screen for us. And this sample is called a QNS sample, quantity not sufficient. I love that painting, by the way. It says so much. And even though you send a sample, and I've told you a few slides before, drug hair analysis and UDS, the cost is exponentially different. Hair analysis is 10 times the cost of urinary drug screens. And even though they receive the sample, they can't do anything with it, hardly. And there's still a processing fee. So they receive the sample, and there's still a charge, even though there's no test. So we don't get any, not only do we get charged, but we don't even get any results from the sample you send. So you can imagine why we call this the screen. So, you know, before I switch gears on the ECGs, I'm going to open up one more time, ask for some questions.
Thank you. Once again, for questions, please press star, then the 1 key on your touch-tone phone. At this time, I show no questions.
All right, well, let's proceed on. So for ECGs, so basically monitoring or recording the heart's electrical activity. ECGs are also called EKGs as well. The illustration below shows what happens during an ECG. You have your participant there, bare chest, the electrodes tied to the chest. We ask that the participant lie flat. And we also ask that a separate table be utilized for the ECG machine. And pretty much this is the normal setup. But what I want to draw your attention to is when you look at A there, and you look at the different peaks of the normal recording, normal rhythm recording of an ECG, look at that T peak. Put a pin in that, because we're going to talk about that in a couple of slides. You see how that T peak goes up? That's a normal reading. Put a pin in that thought. So what does an ECG tell you? One, it tells you your heart rate. It tells you if your heart rate is irregular or regular. And it also tells you how strong your heart beats. So you can imagine the ECG is very important if you're doing any kind of physical activity, if you're introducing drugs into people. You need to be able to determine it. Okay, is this person strong enough? So these readings are very important to the research integrity of our studies. So we always say a 12-lead ECG or EKG, but really there's only 10 electrodes. And so people always say, well, why do we say 12 lead? Well, even though these 10 electrodes or wires are attached to the body, only 10, it provides 12 different views of the heart. So that's why it's called a 12 lead. And as far as preparing for an ECG, it's all about making the participant comfortable. You want to, as you're doing things, you're setting up things, people need to feel comfortable and secure in what you're doing. Always talk through what you're doing. Explain to them what an ECG is. As you're, explain to them why they need to take off their shirt, why you're shaving their chest, why you're rubbing alcohol on their chest. If you just constantly do these things, you may increase in apprehension and anxiety, thus messing with the results. We ask that you, make sure the room is nice and warm. You have an examination table where the participant can lie safely down for about 10 to 15 minutes. Also, after the ECG is read, we allow for you to allow the participant to get up gradually, because lying flat for that bit of time and then abruptly standing up may cause the person to be a little dizzy, unsteady, and you can have a fall. We also ask that you provide paper gowns to participants to make them feel more comfortable, minimize the exposure, and also have a flat, separate surface for your ECG machine because, people move, things like that, and we would hate to have a machine topple over. And also, wherever this flat surface is, make sure it's by an electrical outlet. So proper node placement is very, very key to a proper ECG reading. As you see here, there's ECGs on both the right and left leg. Now, the ECG that's provided for our studies has a green and a red lower leg lead. The green lead is on the right and the red is on the left, as well as the leads on the chest area and the clavicle area are placed certain ways. Please familiarize yourself with this. With these, and also this is a great opportunity to make an laminated card and provide it and have it up wherever you do your ECGs. And so once you complete after turning on the ECG, make sure that you have the 12 leads selected, you have the right option, and when putting in all the participant information, please don't put in their names. Your ECG reading will be a source document, and we don't want any PHI on the ECG reading. please use a placeholder such as an X or a Z. So remember I told you to put a pin in that thought with the different peaks in the normal sinus rhythm. Once again, here's the normal sinus rhythm, and you see that listed T peak. However, when you don't place the nodes right, you see that inverted T peak, it goes down. It jeopardizes the reading of the ECG. So please make sure that you place your electrodes appropriately. I'm going to switch off now to specimen collection and handling, or blood chemistry and hematology. So in our assays, we do collect blood. We collect bloods for LFTs, liver function testing, as well as PKs. Blood is a very, very diverse liquid. It's made of cellular components such as your red and white blood cells and platelets and plasma. So for getting blood from participants, we ask that you check your protocol to make sure that you understand the correct study day. Also, check to make sure you have the correct participant, that you're using the correct collection tube for each measure. The tubes are color coordinated. And I want to go back a little bit to show you what I mean by color coordinated. Right here you have color coordinated tubes. So make sure that you, I don't know if you make a cheat sheet, laminate it, stick it up there. Make sure that you understand which tube goes for which test, and the sequence of collecting the test, and how to treat the sample. All this information is provided in your protocol and ops manual. Know that information. And you want to make sure the collection allows for a quick and efficient cleanup, and you don't want to fumble through. You don't want to fumble through. It lacks professionalism. It makes your participant feel uneasy because you're already poking them and sticking them, getting blood. You want to look as professional as possible to ease any apprehension and anxiety they may have. Also, we ask that you use all the appropriate containers per protocol, and also follow all the procedures for storage and shipping, and completely and accurately document any collection measures. Now, the shipper is responsible for the package and shipping compliance. Often in protocols, we provide you with what type of shipping is necessary for the type of substance or biological measure you are obtaining. And please know, the FedEx guy will not take something that's leaking, something that's not packaged properly, because once he takes it, he himself assigns responsibility for it. And also, if there's any kind of contaminant, any virus, or you are infecting another person simply by giving them a package. So he has the right to say, hey, I do not want this is not safe, and you're stuck with the package. And this could impact randomization, things like that. This one step can further delay any processes down the line. So please make sure you follow all shipping guidelines that are in protocols and your operation manual. So as far as storage, the one thing about storage that is just we get a lot for is the refrigerator and freezer. Depending on the type of biological assay you are testing or how long you're storing it, depends on what type of freezer. Some of you may use -20, -80. Please make sure that your -20 is maintenance on schedule. For -80, in a university setting, they're usually monitored by campus police or an outside entity. And if something should happen with a -80, they will alert whoever's on the contact list that, hey, you need to get here, your -80 has gone down. They usually provide, you should have a loaner freezer on hand to remove those samples and store them so that there's no jeopardizing of the sample, because they're precious. You get them that one time, and you want to make sure that they're viable. And also, on that note, make sure that contact person is accurate. It shouldn't be a study coordinator that left the lab 3 years ago or left the site 3 years ago. Keep that contact current. And as far as your institution's practice, if you're at a university setting, most, if not all, universities have guidelines for safe handling of biological specimens as well as disposable. There's autoclave, there's sharps containers, there's all these measures put in place to keep you safe. So please follow your institution practices. If your institution does not have guidelines, or if you're at a site that does not have these things, then please assess your needs and create a general guideline. And have somebody review it for you and see if it meets standards. What I would say is, if you're going to create that, have your node review it. So as far as all these things tie into good practice, there's the process of actually doing the test, getting the information, the knowledge. This information is in your protocol, it's in your ops manual, and it's in your resources. Your lead node, your CCC, we're here. We're your resources. Values and ethics, knowing what is right, what's not, as far as dealing with the participant, making sure they're calm, making sure there's no anxiety there. Skills. I think what ties with skills is just to know your information, know your protocol, know your institution practices, and be prepared to implement them at any second. So I don't, to harp on anything, of course, biological measures should be collected with your protocol requirements and good clinical practice. If you fail to do so, you jeopardize the research integrity of the specimen and thus of the study. So I'm going to go into universal precautions with dealing with biological specimens. So what you want to do, and I'll talk about ways to reduce exposure, and if you are exposed, ways to respond to exposure. All this is all about decreasing risk. So a lot of accidental occupation transmission happen when somebody's accidentally punctured with a sharp. And what are typically sharps are scalpels, needles, broken glass. You have maybe a needle that was exposed to somebody else and you accidentally pricked yourself through your glasses. That's the occupational transmission. Open cuts that come in contact with contaminated blood or body fluids. These are occupation transmission. OSHA, which is the Occupational Safety Health Administration, mandate training for bloodborne pathogens training. This is typically given to employees that may come into contact with biological specimens. If you're on a university campus, you may have EHS, which is Environmental Health and Safety, which also comes and just to make sure that everything is done, your sharps are labeled, your autoclaving things, all of those types of measures. And essentially what OSHA and EHS want to do, they want to protect employees from HIV, HBV, and HCV. And it's also important to understand when you're collecting blood, there are certain certifications that we require to see of a nurse, phlebotomist, or research assistant. So it's important that these types of people that are doing the blood collection are appropriately trained and have the certifications to do so. So who is at risk? Anyone that comes into contact with blood is at risk for HIV and hepatitis, because we know that body fluids may and can carry disease. And the greatest risk are essentially healthcare workers. But I would say that you're at risk too if you're dealing with a participant that that you have to take blood for PKs and LFTs. And then our participants, the nature of our participants, this is a very, very serious issue. So what are potentially infectious materials? I think the infectious material that sticks out to me for purposes here would be blood and blood products. And it's important to, exercise any caution when dealing with them. Now, there's always this speculation about urine. And people say, well, urine is sterile. Yeah, it is sterile until it hits the urethra. It is sterile until it hits the urethra. And I would say you should treat urine as a potentially infectious material. Wear gloves, be careful with it, because urine can have trace amounts of blood that are not visible to the naked eye. So with that in mind, you want to be careful. And what does exposure mean? I love the picture of the man sneezing. I know I've had people sneeze in my face, and this is just the most grossed out picture I could find. But exposure happens in many different ways. It can happen by somebody sneezing on you, a participant that's sick, sneezes in your face, coughs around you, you're exposed. Infectious, you accidentally pricking yourself with a needle. Treat all exposure as though the material is infectious. You know, go flush your eyes, and I'll talk about that in a second. Flush the wound. Okay. And so as far as prevention of exposure, there's engineering controls, which are out of your control. Engineering controls have to do with ventilation systems, making sure air flows through your facility. You can't really do that. Those are all in how the building is constructed. But what you can do is have work practice controls, not eating in the same location where you may be collecting specimens. Vigorously, once you do collect specimens, every time wipe that area down, and I'll talk about the solution to wipe your area down. Also use personal protective equipment, or PPE, and I'll talk about what PPE is, as well as vigorous hand washing. Always wash your hands. So one work practice control is do not eat, drink, smoke, apply a little eyeshadow or lip balm wherever you're collecting urine, wherever you're collecting blood. Do not handle your contact lenses. I was looking at something. They said we touch our face 1,000 times a day. So that means anything you touch, it is exposed to an orifice on your face, whether it be your eyes, your nose, your mouth, 1,000 times a day. So with that in mind, be careful. Do not eat, drink, and apply makeup in those areas. Also, any refrigerator or freezer that's used for specimens, you shouldn't keep any food or drink in there. You would think these things are common sense, but working in a graduate school setting, whenever the EHS man would come or the OSHA man, it never failed. I would always see students running around with their lunches in the hallway trying to get them out the freezer. It happens. It happens more than it doesn't happen, believe me. Okay, so I mentioned PPE, or personal protective equipment. Types of PPE would be single-use gloves, and I think these are actually the PPE that is most appropriate for our studies. I mean, you're not going to walk in your participant with a lab coat, eye goggles, and a face shield. They will probably laugh at you, and you'd probably look silly. But I would definitely say always wear gloves. Using gloves helps to reduce exposure and frequent hand washing. Tips on removing disposable gloves. I would encourage you to look at this slide, but essentially you do not want your clean hands to touch the outside of your gloves. You want to remove your gloves in such a way that your hands are never exposed to whatever you were touching on the outside. So how do you prevent exposures? Proper handling of sharps. For example, needles. If you're dealing with a sharps basket, usually is metal, small. You have an autoclave bag, maybe. Inside the sharps basket, you place the sharp in there. It's out of the way. You have a closed container. Proper disposal of biohazardous waste. Once again, I would tell you to make sure you understand your institution's practices on proper disposal of biohazard waste. They could be different from setting to setting. And good housekeeping practices. You don't want things lying all around. You want to keep things clean, orderly, constantly wiped down. And, of course, hand washing. I can't harp on that enough. So what should be treated as biohazard waste? All of these things. Gloves, collection cups, needles, towels used to clean the area, anything exposed to a biological specimen. So there are different ways that these things should be handled. For example, and I would definitely say follow your institution or state's regulations for proper disposal of biological waste, because it could be different. Essentially, what I've been trained to do is that with a biologic bag, before it can be thrown away, it has to be autoclaved. That was essentially ingrained in my brain when I was in grad school. But I don't know exactly what's different between each university's practices, but definitely you should know your institutions and states' regulations. And as far as cleaning up spills, follow your institution's procedures. But kind of like common sense cleanup. is you want to clean the area with the disinfectant solution, which is 10-to-1 water to bleach ratio, and dispose of the waste appropriately. So if you're exposed, something gets on your hand, clean and flush the area, provide the necessary first aid if there's a cut, notify your supervisor, document the incident. And same here, flush your eyes. If you have eye exposure, flush your eyes, notify your supervisor, document the incident. Mouth exposure. Spit out any contamination, rinse your mouth several times, notify your supervisor, and document the incident. So for shipping, and I go back to this because in some cases we have samples that are not viable because they're not shipped on dry ice, they're not packaged appropriately, they become damaged by the time they get to the lab. And once again, that's a precious sample. That represented that moment in time for that participant. We can't get that back. So, we ask that you, fill out any laboratory requisition forms, make sure you package the sample appropriately, put it on dry ice, follow all the shipping needs. And if you're going to be shipping, make sure you understand when the last FedEx pickup, shipping on weekends and holidays. There's no excuse not to know these things if you know them beforehand. No excuse for these things to lapse if you know them beforehand. So as far as, additional resources, of course, the CCC is a resource. Your node is a resource. Your institution is a resource, as well as the CDC provides guidelines for infection control in healthcare professionals and personnel. OSHA, and I'm going to put on here environmental health and safety, as well as regulations of the DOT and the CFR. So please consult those things for resources, and always we are available, the CCC. So at this point, I will take any questions from the audience on any part of the presentation.
Thank you. Once again, for questions, please press star, then 1 on your touch-tone phone.
I can't be that good of a presenter. I can't be. Or maybe you've had this drilled in your head at various investigator meetings.
I show no audio questions at this time.
Okay. All righty then. I guess it was clear. I'm going to turn it over to Tracy.
Okay. Well, thanks, everyone, for attending. Thank you, Rashana, for presenting a very insightful and comprehensive understanding of biological measures. We have another presentation next month, July 18th, which will be on co-occurring disorders, integrated treatment and addiction, and mood and anxiety disorders, to be presented by Drs. Dennis Daly and Antoine Duhaihi. And those invitations will go out to everyone in the CTN database within a week or so. Also, you should receive a survey. Please take a moment to review the survey. And thanks, everyone, for attending. If you have any additional questions that may occur after this webinar, feel free to send us an email at ctntraining@emmes.com. Thanks, everyone, for attending. Goodbye.
Thank you, ladies and gentlemen. This concludes today's webinar. Thank you for participating. You may now disconnect.